Welcome to session 5 of Nurs 246, Nursing Practical 3. My name is Mrs. Cecilia Eliason. We will continue with gastric lavage. In this session, you'll be provided with the guidelines for the performance of gastric lavage for clients from whom it has been indicated. Gastric lavage is the aspiration of the stomach contents and washing out of the stomach by means of a gastric tube. By the end of this session, you should be able to discuss the purpose of gastric lavage, identify the equipment required to perform gastric lavage, demonstrate gastric lavage for clients in the ward, describe the complications of gastric lavage. The key topics to be covered under this session are purpose of gastric lavage, procedure for gastric lavage. And for your readings, you have nursing procedures and protocols by Dump, and then clinical nursing procedures, the art of nursing practice by Anamam. Purpose of gastric lavage. Gastric lavage is a procedure in which a tube is passed into the stomach through the mouth or nostrils, and water or normal saline introduced to wash out its contents. The purpose is to obtain samples of gastric content for laboratory studies, and also to relieve nausea and vomiting in case of acute dilatation of stomach, pyloric stenosis, and intestinal obstruction, to reduce gastric bleeding, to cleanse the stomach before endoscopic procedures, to remove poisonous or irritating substances from stomach. Gastric lavage may be dangerous after the ingestion of acids, alkalis, hydrocarbons, or petroleum distillates, after the ingestion of strong corrosive agents, and then in the presence of convulsions. Procedure for gastric lavage. The requirements are: 1. You need a trolley with the following items: a funnel attached to an NG tube, a solution for washout in a jug, an empty measuring jug, a tray containing gallipot with swabs and lubricant, NG tube, a receiver for used swabs, a vomit bowl or a nurse's bowl, a Macintosh and a towel, mouthwash, 20 to 50 ml syringe, blue litmus paper, a pair of gloves, mouth gag and tongue disperser, specimen bottle for stomach content, a stethoscope, mask, floor Macintosh, and buckets. For the procedure, identify client and check the chart for physician's order and any specific instruction. Explain procedure to patient. Ensure privacy. Wash hands and don gloves. Remove dentures if present and insert a mouth gag. Place client in high Fowler's position or in recumbent position with head turned to one side if unconscious. Protect client's chest with Macintosh, cape, and cover with towel. Place bucket on floor Macintosh by client bedside. Wash hands, dry and don gloves. Pass lubricated NG tube slowly and gently to prevent trauma to the tissues. Ensure proper placement of the tube. Secure the tube with adhesive tape. Attach syringe to the tube and aspirate gastric content and save it for laboratory analysis. Remove the syringe. Fill funnel attached to the rubber tubing with water or normal saline using the measuring jug. Run through to expel air and clamp. Connect rubber tubing and funnel to NG tube. Pour more fluid into the funnel, about 300 ml, and open clamp to allow the fluid to run into stomach. When about 300 ml of fluid have run into the stomach and before funnel is completely empty, pinch the tube. Wait for 1 minute. Invert the funnel over the bucket to allow the stomach content to be siphoned out. Repeat until retained fluid is clear. In case of GI bleeding or gastrointestinal tract bleeding, if blood increases in the outflow, stop the procedure and inform the physician. During the procedure, observe the client's vital signs and degree of consciousness every 15 minutes. Clamp and remove the NG tube and put it into a receiver. Leave stomach empty at the completion of lavage. Remove gloves and wash hands. Give client a mouthwash. Make him comfortable in bed. Discard trolley. Clean, sterilize, and store equipment. Label specimen for laboratory investigation. Wash hands and dry. Record procedure with date, time, amount of solution used, character of retained flow, and condition of client before, during, and after the procedure on the nurse's notes. Continue to monitor the client every 30 minutes as prescribed by his or her condition. Check vital signs, temperature, pulse, respiration, and blood pressure. Nausea and abdominal distension. In conclusion, thorough hand washing is essential for the nurse and the client before and after the procedure. All dressings and disposable items to be discarded. The GI tract is not a sterile passageway. The natural enzymes and acid in the stomach and esophagus are usually sufficient to kill any problem microorganism. The lining of the GI tract is delicate. However, an insertion of the tube may traumatize the lining and allow an entrance for pathogens into the system. For this reason, it is essential to insert the tube gently and to avoid using force if resistance is met during insertion. For your assignment, provide gastric lavage for a client for whom it has been requested in your facility. Document your pre, intra, and post-procedure observations. For your references, we have Anaman et al. 2007, Clinical Nursing Procedures, The Art of Nursing Practice, and then Michelle Dome 2003, Nursing Procedures and Protocol, and then Nurses and Midwife Council Protocol Book for Procedure Manual for Nurses in Ghana. Thank you.